Hi, everyone. Welcome to our second Pulse poll briefing. We will give folks a minute to enter the webinar and then we will get started. Welcome to folks that are joining us. We're going to let people have one more minute to get into the webinar and then we'll get started. Okay, great. I will get us kicked off. Good morning, everyone. We're so thrilled that you're here with us today. I am Katie Peshik. I am a Senior Communications Officer with the Colorado Health Foundation, and we are very excited that you joined us this morning for the second briefing to go through the results of our 2025 Pulse poll. Before we dive in, just a few quick housekeeping notes. We'll start with a walkthrough of our Spanish language interpretation features and for more information about the Foundation's commitment to language justice. And for that, I'm going to turn it over to our partners at the Community Language Cooperative to explain how interpretation will work during today's webinar. Bea, please take it away.
Thank you so much. Good morning, everybody. My name is Bea. My pronouns are she, her, ella, and I'm with the Community Language Cooperative, or the CLC, and we want to thank you, as always, for your commitment to language justice, which means that everyone should have the right to speak in the language of their heart. To achieve this today, we'll be using Zoom simultaneous interpretation function. In a moment, we will activate that, and you will see a globe at the bottom of your Zoom screen, which says interpretation. You'll click on that globe and select either English or Spanish as the language of your heart. If you don't see that globe pop up, you will find this function under the More menu on your Zoom account. I'll go ahead and repeat this in Spanish and then we can get started. Hola, buenos días. Mi nombre es Vi Torres, mi pronombre es ella y yo seré su intérprete con la CLC o la Community Language Cooperative y les agradecemos como siempre su compromiso con la justicia del lenguaje, lo cual significa que todos tenemos el derecho de hablar en el idioma de nuestro corazón. En un momento se activará la función de interpretación en Zoom y aparecerá un globo terráqueo en la parte inferior de su pantalla. Favor de hacer clic en ese icono y elija inglés o español para escuchar en el idioma de su corazón. Si acaso no aparece el globo terráqueo, puede encontrar la función de interpretación debajo del menú que dice More o Más. Muchas gracias. Ya comenzaremos. Thank you very much. We can go ahead and activate interpretation now.
Wonderful. Thank you so much, Bea. I just have a few additional reminders before we begin. Today's webinar is being recorded and will be sent via email after the briefing and can also be accessed on our Pulse Poll website at copulsepoll.org. Closed captioning is available via the control bar at the bottom of your Zoom screen. If you experience any technical issues, please use the chat function to reach out to us so we can help you troubleshoot. And also, we welcome your participation. So please use the chat function to share your thoughts and questions throughout the session. We'll answer some questions via the chat and also leave time for questions at the end of the presentation. So on the next slide, just want to say for those who may not be familiar, the Colorado Health Foundation is a statewide philanthropic organization. We champion the health and well-being of every Coloradan by advocating for and investing in solutions that advance health equity and racial justice. Our work is grounded in the belief that health and well-being should be within reach for everyone. And Pulse is just one of the tools that we use to listen to and partner with communities across Colorado. On the next slide, just a little more about Pulse. The Health Foundation launched the annual Pulse poll in 2020 to better understand the perspectives of adults across Colorado on the issues that impact their health and well-being. Pulse is not a single issue poll. We ask about a wide range of topics, and we also invite Coloradans to share in their own words what matters most to them. Through the poll, we gain insights into how people are feeling and what they're concerned about. And we share those findings with policymakers and community leaders and the media and anyone who is interested. In keeping with our commitment to transparency, all data is publicly available and is on our website at copulsepoll.org. And we also have an interactive dashboard that just launched this week and that we'll be highlighting today that allows you to go through the data and slice and dice it as you need. And in keeping with the Foundation's commitment to racial justice, we intentionally oversample key communities, including Black Coloradans, Asian Americans and Pacific Islanders, and Native Americans in Colorado. This helps us to ensure that the experiences and priorities of these communities are meaningfully represented in the data. Today's session is the second of 3 briefings that we're hosting to walk through this year's Pulse findings, and you can find a recording and a release about the first briefing on our website. I'll also drop a link to register for our final briefing, which will be on September 10th, and will focus on our Hispanic and Latino, specifically on the experiences of Hispanic and Latino Coloradans. So with that, I'm excited to turn things over to our research partners who help us to lead this work every year. Please welcome Lori Weigel and Lucia Del Pufo, who are part of the research team that conducts the Pulse poll on behalf of the Colorado Health Foundation. Lori, I will turn it over to you.
Great, thank you so much. We're excited to share some additional findings. Everybody can go back to phase 1 and sort of revisit some of those. We're going to dig a little deeper into some of the specific data and then also share some other questions that were asked in this year's survey. So just as a reminder for what we did, again, the reason you have 2 researchers on this call is we represent a bipartisan research team while we speak to and listen to the thoughts of all Coloradans across the partisan spectrum, across many of the subgroups that you see represented here, and certainly across geography. Our firms, if we work in partisan races, do so on opposite sides of the aisle, but together we've worked together for 22 years on a range of policy issues and have co-conducted this survey, the Pulse survey, every year of its existence. And you're going to see lots of trend data that goes back to 2020, so we can really see how Colorado is changing or not on a lot of key issues. This year, we conducted interviews from April 19th through May 18th. We used a number of different ways to contact Coloradans and incorporate their views into this survey. And so you can see in terms of contact, they received telephone calls, email invitations, text invitations. So some people were able to participate via phone, some people were participating online. The survey is conducted in both English and Spanish, so we're able to reach respondents irrespective of the language of their heart, as I think it was said earlier. And we speak to a lot of people as well. So over 2,300 Coloradans participated in this survey and gave us their thoughts and views. So that's really exciting. Again, as was indicated, we conduct additional interviews of certain ethnic and racial backgrounds, as well as residents of Morgan County. We then weight those back. So statistically, it is still all the numbers that I'm going to share and Lucia is going to share are representative of Coloradans across the spectrum. Of course, with any survey, there's a margin of error. In this case, it's just over 3%. So again, that's the boring part. And here's just a reminder on how we reached out to people. And here's the regions. So I'm going to reference a few times some different regions of the state. And again, this is just indicating people slice and dice the state up a little bit differently sometimes. This is how we're representing it. So we'll talk about the Denver metro area, which represents a majority of the population of all Coloradans. When we speak to the Colorado Springs region, we're talking about El Paso and Pueblo County there. And then you guys are going to be able to go on the Pulse website, be able to look at data for any of these regions for lots of different subgroups. It's one of the coolest interactive tools I've ever seen related to any sort of polling. So this is just one way you'll be able to really examine and dig in yourself into lots of the data that we're going to share today. So, okay, let's talk about Coloradans. We asked a series, and we have asked a series of questions over the last several years related to Coloradans and mental health. It was something that really emerged following the pandemic as a big concern for Colorado. And so starting in 2023, we started asking Coloradans to tell us whether in the last year they had experienced mental health strain. And we gave them 4 examples, such as anxiety, depression, loneliness, or stress. And as you can see, this is one area where the data hasn't changed a whole lot over time. We have consistently had a majority of Coloradans telling us that they are experiencing mental health strain. Now, underneath that overall 56% this year, and really it's been within margin of error the last several years, you can see there's some subgroups of Coloradans that are distinctly more likely to tell us that they have experienced mental health strain. So it could be those who are in housing that's unstable, unemployed right now, lots of financial aspects that we're going to talk about in a second. They also tend to be younger, somewhat younger than the overall population. You can see renters are expressed here, somewhat lower income in terms of household income. But we're also seeing some other subgroups, such as self-described liberals, for example, that are now in an upper tier of those indicating that they're experiencing mental health strain. And the reason for that is, for the first time, we asked people to tell us in this sort of succinct question, which of the following contributes the most to your mental health strain? This was an open-ended question that we then collapsed into certain categories. And political issues actually was the top reason that people told us they're experiencing mental health strain this year. 32% indicated that. It just edged out financial issues. And then certainly there were a host of other issues, whether it's family and relationships or workplace issues, unfair treatment because of some aspect of their identity, with 2% who had experienced mental health strain indicating that was the reason. And then just a cornucopia of other rationales that are captured in that something else category. But it's really striking that politics is now eclipsing finances in terms of how people are telling us what is contributing to that mental health strain. And notably, it's not just one party or the other. Democrats, independents, and a significant portion of Republicans are indicating that political issues are what's contributed the most to mental health strain, although financial issues barely edges out political issues for Republicans, whereas that's the opposite among Democrats or independents here. So again, sort of an interesting dynamic where politics is a big concern and even affecting our mental health in the state. Notably, it is sort of a luxury concern in terms of politics because, as you can see here, when we look at Coloradans broken out by household income, those in the upper tiers of income are more likely to talk about politics contributing the most rather than financial issues. In fact, we get sort of a mirror image of each other if we look at those Coloradans in the lower income households versus those in the upper tier there. And same thing in terms of home ownership, which really is also tends to be a function of household income as well, versus renters, who are more likely to say financial issues are contributing the most. So some interesting dynamics there, but it's worth noting that those who are experiencing mental health strain, again, a majority, 56% of all Coloradans, they're more likely to say a number of different things are serious problems affecting our state. And we're going to talk about some of these in the overall data in a little bit. But you can see whether it's rising cost of living, cost of housing, cost of healthcare in particular, that for many of these issues, those who say they are experiencing mental health strain are far more likely to view those as serious problems, usually by about 10 points, as compared to those who indicate not experiencing mental health strain in the last year. Going along with this, we asked a number of different experiences that I'll talk about in a second, but one of those was asking them whether in the last 12 months they've postponed mental health care. And that has been about a quarter of Coloradans the last couple of years. It slips slightly under that to about 1 in 5 Coloradans, indicating that they have postponed mental health care in the last year. And again, we know from past years when we've asked why they postponed that a lot of it is really tied to financial challenges. So therefore, it's striking that those in somewhat lower incomes, those who are renters, those who are without employment at this time are the most likely to say that they've postponed mental health care versus any other sort of demographic or behavioral subgroups. So let's talk about Coloradans on the margins, because we know that the experiences of all Coloradans are not completely shared, not just in terms of mental health, but on lots of different aspects. In fact, we looked at a number of challenges, and we've consistently looked at many of these, and I'll walk through some of that trend data here. But we're highlighting 5 of these, and we've got a segmentation that'll tell you a little bit more about which Coloradans are experiencing more of these more often. So it's not just mental health care. We have 30% that say they've postponed medical care in the last year, just over that saying they've postponed dental care. We have about 1 in 5 Coloradans said they've had to work hours or cut back or had their wages reduced. Had work hours cut back or wages reduced. And in fact, we have just under 1 in 10 who say they have been laid off from employment in the last year. And the one that always gets me, and I try and remember every Thanksgiving, is the 12% who have indicated that they've skipped meals because they could not afford food for their family in the last year. So that's a number of different challenges in the last year. I guess if there's any good news in any of this is that the data is somewhat lower than what we have seen in past years. So since 2021, we have asked respondents to tell us whether they or not they have postponed medical care in the last year. This is the lowest number at 30% that we've seen. Again, going back to 2021 and looking at all Coloradans. Again, there's a number of different subgroups that are more likely to indicate postponing medical care. And again, it's sort of similar to some of the subgroups that we saw when we talked about mental health care as well. Similarly, in terms of postponing dental care, again, the lowest number that we've seen, but it's still 1 in 3 Coloradans that are telling us that they have postponed dental care. And again, a lot of it relates to household income, finances, whether or not they have employment, have insurance, therefore, as well, in terms of who is more likely to postpone that care. When we look at more the jobs aspect and whether they've had work hours or wages reduced in the past year, that's down only slightly, but it's at 19% today as compared to 23% in the past. And again, we see for those in the lower household incomes, they are more apt to tell us that they've experienced this and had work hours cut back or wages reduced than our upper income Coloradans. We see the same thing for communities of color in the state. They are almost 10 points more likely for some of them to indicate that than white Coloradans overall. And then just a couple more trend charts. Just under 1 in 10 Coloradans have been laid off in the past year. This has been pretty similar over time and not moved around as much. And again, it has consistently been those in lower income households experiencing that. And then in terms of food insecurity, again, 12% today saying they've skipped meals because they couldn't afford food. That is bounced around some. It was higher last year at 17%, the highest, but 5 points lower today. We'll see if that hopefully goes even lower into the future and very much relates to household income. I would also note it's 1 in 5 among our American Indian, Alaska Native respondents who indicated having skipped meals because they could not afford food. If we look at all of this, notably, there's a significant number of Coloradans who are experiencing multiple. Something happened with the slide when I went into slideshow, so you're not going to see the data here, but it is a majority, a bare majority, but 51% that are indicating that that they experienced at least one of those challenges that we just talked about. 1 in 5 have experienced at least 3 of these challenges as well. So that's a significant portion, 20%. They're telling us that they've experienced some of those. And in terms of those financial challenges, if we look at those who are most likely to be experiencing multiples of these, 3 or more, again, a lot related to income, whether or not they have employment, whether or not they own a home. So renters are more likely to be experiencing a number of these financial challenges. I noted before that American Indian, Alaska Native populations are more likely to experience some of these, and they are more likely to experience 3 or more of these. And then LGBTQ respondents were also more likely to have experiencing multiples of these financial challenges. So some real distinct differences across the spectrum in terms of who's experiencing multiples of these different types of hardships. Notably, again, this goes along with mental health strain, and we saw that many Coloradans are attributing their mental health strain to financial challenges. So among those who are experiencing mental health strain, they're more likely to say their finances have gotten worse, that they're struggling financially. They've experienced a number of these different issues, or they're worried about losing health insurance in the future. So for many of them, it's just, sort of compounded that every single question we're asking about and experience we're asking about, they are more likely than Coloradans overall to indicate that they're facing those particular kinds of hardships. Whew, that was a lot. Okay, so I'm going to pass it to my colleague Lucia to talk about some other things that we asked about in the survey and some of the regional and partisan differences that we saw.
Thank you so much, Lori, and it's a pleasure to be here today. So I think I'm going to dive in here and talk a little bit about some of the top issues facing Coloradans and how those really vary among regional and partisan lines. So if you attended the first presentation of the data, some of this initial part may look familiar. But one of the questions that we've asked pretty much every year of the Pulse poll has been about problems facing the state. And we've asked folks to rank these in terms of extremely serious, very serious, somewhat serious, or not too serious. And they're ranked here by the percentage who said they were extremely or very serious. And one of the themes that's really come up in recent years and has been consistent in the past couple of years is that cost of living is a top tier concern. All of the items that 3/4 or more are saying are very serious problems relate to cost of living, cost of housing, cost of healthcare, and even homelessness, which is closely related. We saw nearly 2/3 pointing to drug overdoses as a major concern, as well as majorities saying mental health, jobs in the economy, wildfires, and crime. And as I dig deeper in a moment into some of those demographics, we're going to start to see some more distinctions on those middle tier and lower tier priorities, but those top ones really tend to cut across many major demographic groups. On the next slide here, you can see kind of the remaining items, and we do see a majority concern for drug and alcohol abuse. When we get into things like climate change, illegal immigration, restrictions on reproductive rights, hunger, gun violence, mistreatment of immigrants, police violence, racial bias, and crime in your neighborhood, we do start to see that level of intensity and concern about these problems decreasing. But what we'll see is that folks are pretty divided on a lot of these issues. I do want to draw your attention to the fact that crime in your neighborhood is so much lower than crime in general. And I think this is a trend that we have seen not only in Colorado, but nationally, where folks tend to be more concerned about crime in abstract than the crime that they actually encounter on a day-to-day basis, or that they feel at risk of encountering. So on the next slide here, you can see some of the breakouts by the regions of the state. And I think there are really some interesting distinctions here. One thing that really jumped out at our team was the variation when it came to wildfires. While 56% of Coloradans said this was a very serious problem, and majorities in most regions of the state agreed, in the Eastern Plains, it was only 18% who said this was very serious. Similarly, we see variations, particularly in the Eastern Plains, around cost of housing is much lower of a concern there than it is in other regions, even though other cost items are just as high or higher there. And similarly, job in the economy is more acute there than it is in other parts of the state. So definitely some variations. We also see some other kind of divisions, whether it's around immigration, reproductive rights, that I think can be driven by some other kind of demographic factors that we'll look at in a moment. So on the next slide, one of the things that was really striking was the difference that we saw in how folks rated these problems by their urbanicity. So for example, those living in in urban areas were much more likely to express a high degree of concern about wildfires relative to those in suburban and rural areas. On the second item with crime, we saw the opposite. We saw crime in general, suburban and rural Coloradans were more likely to express concern, about 2/3, saying it was a very serious problem, compared to about half of those in urban areas. But if I can draw your attention to the very bottom line there, when you ask about crime in their neighborhood, it's actually almost twice as likely to be concerned, or residents of urban areas are almost twice as likely as those in suburban or rural areas to say it's a serious problem. It's obviously much lower than their concern about crime in general, but it is interesting that those who are least likely to say they're worried about crime in their neighborhood are more likely to worry about crime in general. Other kind of dynamics that we saw along the urbanicity lines was along climate change. And again, that could be one of those factors where folks who live in urban areas tend to be a little bit different ideologically than those in suburban and rural areas. And that could be driving some of the dynamic that we see there, where there's much higher concern about climate change in urban areas. And on the flip side, about illegal immigration, almost twice as likely, rural residents are almost twice as likely to be concerned about that relative to urban residents. And again, a similar dynamic when you look at gun violence, mistreatment of immigrants, and racial bias and discrimination. On the next slide, we actually broke it out by partisan affiliation. So we took the subset of our respondents who were registered voters and looked at them by their partisan affiliation. And we do see some really notable distinctions by party. So for example, on climate change, Democrats were 77 points higher in terms of their rating of this being a very serious problem relative to Republicans. Similarly, mistreatment of immigrants, restrictions on reproductive rights, and gun violence, we saw really big gaps there. And on the bottom of the slide, you'll see that crime in general, Republicans were 50 points more likely to say that crime in general was a very serious problem, and they were 66 points more likely to say illegal immigration. So I think some of those regional and urbanicity dynamics that we saw were driven by some of these underlying ideological views, but to another extent, some of them are really driven by lived experience and what it's like to live in those areas as well. So in this next section, we're going to dive into Coloradans' views on taxes. So we both explored their experience of feeling like they were paying the right amount or too much or too little, as well as what kind of public services they wanted taxes to be used for. So as I noted a moment ago, we asked folks whether they felt like certain groups paid too much, the right amount, or too little in taxes. We saw that majorities agreed that their own households, low-income people and middle-income people, as well as small businesses, are paying too much in taxes. In contrast, majorities view that high-income people and large corporations are paying too little in taxes. But there were some distinctions when we dug into the different demographic groups and how they perceive this. Strikingly, majorities across all income levels agree that their own household is paying too much in taxes. But we did see that folks with household incomes of over $150,000 were much more likely to say that high-income people are paying too much in taxes relative to those with incomes below that threshold. We also saw that folks with incomes under $100,000 were more likely to be saying that lower income people are paying too much in taxes relative to those with higher incomes. So definitely some variation there and based on folks' income. And then on the next slide, you'll see some of the differentiation by party among, again, the subset of our respondents who were registered voters. And what's striking here is that in almost every instance, Republicans are saying that everyone is paying too much in taxes at a higher rate than Democrats and independents are. So their own household, middle income people, small businesses, high income people, and large corporations. But when it comes to low income people, Democrats are much more likely to say that lower income people are paying too much in taxes, as are independents are more likely to say so than Republicans. So as I noted earlier, we also explored how folks felt like taxes should be used. And we provided a list of public services that are funded by state and local taxes. And we asked folks to tell us if each of these was extremely important, very important, somewhat important, or not important as a use of their tax dollars. And you'll see them there on the right. They're ranked by the percentage that found each extremely or very important. Public safety was by far the top item. 44% said it was extremely important and 80% said it was extremely or very important. And then the remaining items were kind of very closely grouped together. 3 and 5 to 2/3 saying that stimulating jobs in the economy, mental health care, physical health care, and housing were all very important. But as we look into some of the demographics, again, we do see some distinctions really emerging. When we look again at this subset of voters in our sample, we do see strikingly that public safety is something that folks across the partisan spectrum really agreed on, and 4 and 5 of Democrats, independents, and Republicans all said this was extremely or very important. But for the other items, we do see a gap. We see Democrats and independents, but particularly Democrats, saying that allocating tax dollars to these items is very important, particularly when compared again to Republicans. So at the very bottom, we see a 47-point gap between how important Democrats view investing in housing is versus Republicans, and a 41-point gap when it comes to physical health care. The gap is very similar on mental health care, and then a little bit narrower on stimulating jobs in the economy. That's one that majorities across the partisan spectrum view as very important. And then on the next slide here, you can see some distinctions by racial and ethnic groups. And I think what's really striking here again is we do see that public safety item really close to the top, if not the top item across folks of all backgrounds. We do see white Coloradans assigning lower priority than folks of other demographic groups, but it's still a majority saying each of those is extremely or very important. And strikingly, 91% of Black and African-American Coloradans said that it's very important to fund physical health care. That's also very high among AAPI Coloradans, but that 91% really jumped out there. And then another thing to notice is that when it comes to mental health care, physical health care, and housing, American Indian and Alaska Native Coloradans really rank those pretty similarly to white Coloradans and a little bit lower than other folks do. So then on the next slide here, in this section, we dove into views on civic engagement and how folks felt like they could make a difference and what is possible in terms of making a difference. So on the next slide here, we asked folks to rank a series of different activities that could improve their community on a scale of 1 to 7. 1 was very ineffective and 7 was very effective. And they're ranked by the average score, which you can see on the right. But the one that really kind of jumped out and was most seen as impactful was this idea of volunteering with organizations and social causes that they care about. About 7 and 10 said that this was, effective overall, and it was the kind of item that popped to the top there of that list. We do see a majority saying that communicating directly with policymakers, speaking at public meetings of local government, and publicly expressing their support for social causes is effective overall. Stating their own opinion openly, publicly expressing support for political candidates or expressing themselves on social media, all of those were kind of less impactful and seen as less effective, particularly posting on social media. And on the next slide here, we do see a pretty big gap when we look again at those voters in our sample. It's really striking that Democrats and independents generally, particularly Democrats, feel like all of these things are more effective than Republicans do, that they feel like these types of civic engagement can make a difference. But again, volunteering with organizations that they care about was something that Democrats and independents at similar rates felt was effective, but again, at a much greater rate than Republicans did. And then when we look at it by urbanicity, folks who live in urban and suburban areas were more likely to view volunteering as something that could make an impact, particularly those in urban areas, a little bit more concentrated there. We did think it was really interesting that publicly expressing your support for social causes was seen as more effective by residents of suburban areas, and they were twice as likely to say it was very effective as were residents of urban and rural areas. So very different there, and could be driven by some of the different experiences that folks have living in a suburban community versus an urban or rural community. So with that, I will pass it back to Katie, and we'll have an opportunity to answer questions about the data later on as well.
Thank you so much, Lucia, and to Lori. A lot of really interesting data, and just a reminder that we'll share the full presentation following today's webinar. And we also do encourage you to visit our website at copulsepoll.org to explore the interactive data dashboard and see the resources that we have available there. So now I'm excited to turn it over to two valued community partners who will share a little bit more about what the impacts of this data, how it's being felt by nonprofit organizations across the state, and what it means for our work here at the Colorado Health Foundation. So first up, I'd love to introduce a wonderful colleague of mine. Michael Smith is a senior program officer at the Health Foundation, where he plays a key role in the foundation's advocacy priority and our locally focused work across Colorado. Michael, I'll hand it over to you.
Thank you, Katie. Good morning, everybody. As Katie mentioned, my name is Michael Smith. I'm a senior program officer at the foundation. My pronouns are he, him, his. And I appreciate you all for joining us for this presentation and conversation today. This is incredible information, and I'm so grateful that we're able to support Coloradans through this information. And so how do we at the foundation respond to this, particularly within our grant making? As Katie mentioned early on about our mission at the foundation, our grant making is a key role in attempting to advance that mission. And so we seek to do that by disrupting longstanding inequities in access to health, influence, and income. The Pulse data further helps illustrate, where these inequities are continuing to show up and who is being impacted the most. And as you may know about the foundation, our mission is grounded by cornerstones, which essentially means that we do everything at the foundation, all of us, with the intent of advancing health equity. We seek to support organizations and efforts that are community informed, and we prioritize Coloradans that have historically had less power, income, and privilege, and we prioritize Coloradans of color. And so what the Pulse data for me reinforces is the importance of community engagement and spending intentional time in various communities to understand the myriad needs and opportunities that exist. And Pulse is one source, but an extremely important and critical source of information for us within the grant making department specifically to assess whether or not our funding priorities are moving the needle on bringing health further in reach for the populations we prioritize, Coloradans of color and those of low income. Over time, we continue to see, as folks have mentioned early on, the continued expression of Coloradans that cost of living is a concern for them. Therefore, we want to go deeper into this. And so as such, we've started to peel back the layers of what economic opportunity even looks like for folks in Colorado, and also have a new priority area that is seeking to uncover that as well. Pulse helps to inform that along with other information, but Pulse is a key aspect of how we at the grant making department and overall the foundation think about our utilization of our funding priorities in order to address the deepest inequities across the state. I co-lead the advocacy priority at the foundation. That's one of about 9 to 10 active funding priorities that we have at the foundation. We also fund in primary care, adult recovery, thriving young people, affordable housing, community solutions, capacity building, and locally focused work. You may have heard folks mention Morgan County earlier. That is a community that we work in through the locally focused work priority, of which I am responsible for that. So advocacy is another key priority of the foundation, and civic engagement is essential to that. And so when I saw the responses to what Coloradans expressed around civic engagement, thinking about everything in totality, I was not surprised. We just came off a huge presidential election year. The ability for us as folks in society today to have access to information globally as well as domestically through social media puts us closer in understanding the kind of iterations of politics and government more broadly. And it helps to put things more in acute and immediate and urgent ways. And so that feeling of Coloradans regarding to government and politics was not shocking to me. I think as you saw the other data, particularly around housing costs, cost of living, cost of healthcare, and how that continues to squeeze families, folks are looking for somebody to help. And a lot of times folks look at government and politics to be that source of protection, the source of intervention. And so for folks who are feeling immediate, urgent needs relative to their financial challenges, of course, they're going to express some frustrations and impatience within our government functions, our government leaders, and also our elected officials. We believe within the advocacy priority that civic engagement is essential to building a healthier and more equitable Colorado. We see that there are so many services and supports and infrastructure that all of us rely upon every day to maintain our quality of life. And so we recognize that civic engagement is an essential function for folks to be able to influence and inform and shape the way in which government action, government funding, and administration shapes those different services and supports and infrastructure that we rely upon so deeply. And so we seek to fund through advocacy primarily different forms of civic engagement across the state. That shows up to us in every corner of the state. We seek to understand that in every single corner of the state, recognizing that in urban communities, in suburban communities, and rural communities, civic engagement may look differently and may take shape differently. And so how do we support that through our funding? We fund a lot of voter engagement work, voter education work, voter engagement work, community organizing, and coalition building. And as I mentioned, we fund that at every level possible, recognizing that civic engagement can take a different shape across different corners. And so our goal with this, within our civic engagement support, but broadly within our advocacy work in general, is to support the activities that build individual and collective power in hopes that Coloradans see their voice, hear their voice, and see that their voice can matter, and believe that expressing their voice to elected and appointed officials will lead to changes in policies and systems. We just saw through the presentation by Lori and Lucia how there's so many things, particularly within the finances that we rely upon through public revenue, that we have a significant role as everyday Coloradans to express our voice in. And so we just hope at the foundation we can play a role in further disrupting those inequities that unfortunately are tied to inequitable distribution of public resources, and make the case for Coloradans that lending your voice to these matters is essential and critical. And so I'll pass it back to Katie.
Michael, thank you so much. I just really appreciate you adding so much context and color to the data that we heard today. I'm happy to introduce our next speaker, another wonderful community voice. Julie Reskin is the co-executive director of the Colorado Cross Disability Coalition. CCDC is a leading disability rights organization that works to advance social justice for people with all types of disabilities. And we invited Julie here today to hear her thoughts and reflections on the Pulse data and what it means for her work at CCDC. So Julie, I'll hand it over to you.
Great. Thank you so much. And thank you for inviting me, and thank you for doing this work. This poll is really valuable to those of us in the nonprofit world, and particularly as a member and a leader of an impacted community. This did not surprise me. Audre Lorde said that there's no such thing as a single issue struggle because we don't live single issue lives. And that's what struck me when I was reading that the financial and political were the biggest source of stress, which again, no surprise, but you can't separate the financial from the political. They're really intersectional. And so whether someone defines something primarily as financial or political is almost immaterial. They're connected. It's a community of people with disabilities that relies very, very heavily on Medicaid to stay alive and to be free. Our fear is that when the Medicaid provisions of HR 1 kick in, this stress is going to escalate. And it's not only people with disabilities who are affected. There are a lot of groups that are being targeted right now. In the past, people with disabilities have generally been hit first and hardest when their Medicaid cuts, because we're the most expensive. I wanted to talk about one particular program that's going to be hit because it really hits at the economic issue and the jobs issue and everything you've just talked about. We've had for about 10 years, a little over 10 years, a program in Colorado called Working Adults with Disabilities that let people with disabilities get out of poverty, work, and pay into Medicaid. And it's funded, and about 25,000 of us are on this. It is the only path out of poverty. It's funded by the hospital provider fee or provider tax, whatever you want to call it. And if that, which is going to be cut in half after 2028. If this program goes away, there are two choices for the 25,000 of us that use this program. We can either stop working, go back into poverty, which to become Medicaid eligible in another way, which will cause many people to lose their housing, or go without health care and try to pay for what they can, which is not going to be adequate for most people. My personal story is that the year before I had Medicaid, I was in the hospital 14 times. In the 30 plus years that I've had Medicaid, I think I might have spent one night or maybe two overnight in a hospital, despite having a significant disability. That's the difference Medicaid makes to people with disabilities. And again, for a lot of people, it's not just being in the hospital. It might mean it means losing your life. So this is very, very personal to the folks we represent. In terms of the social political frame, the lack of social discourse is adding to the social isolation, fear, loneliness, and despair. And it's concerning that so many find reaching out to their elected officials to be ineffective. So what do we do with this? Well, in 2017, when we went through the Affordable Care Act fight, Medicaid was a dirty word. And all of the messaging people said, you don't talk about Medicaid, you talk about it in some other way. But today, Medicaid is popular. It polls well. People know that it's a great program. Well, of course, there's room for improvement. It preserves liberty and life, which are supposed to be American values and rights. Well, but the other thing to know is while people do not want to talk to politicians as much, they do really want to work with nonprofits. This difference resonated with what we're experiencing at the Colorado Cross Disability Coalition. So what this means is that we need to refine and improve our whole strategy on civic engagement. This is a time when the nonprofit community must step up like never before. It's on us to change the negative and hateful discourse by doing what we have always done, but doing it smarter and more. That's sharing our stories, supporting impacted people to lead, and making sure that our people know that not only do we have a seat at the table, but we own the table because we built the table. This means that we bring people together to have really tough conversations, but also to foster human connection. And that's the antidote to the isolation, which we believe is breeding the fear, which breeds hate. When people are together, it's hard to hate up close. It's easy to get discouraged. It happens to me about 10 times a day, and certainly every time a new executive order comes out, which feels like 10 times a day. And I try and remind myself what one of my heroes, Dolores Huerta, the amazing labor activist, said, which is every moment is an organizing opportunity, every person is a potential activist, and every minute is a chance to change the world. Thank you so much for this amazing data.
Julie, thank you so much. I really appreciate all that you've shared, and we're so lucky to partner with you through our work at the Health Foundation. We do have a little bit of time for questions. If you have a question, please feel free to add it in the chat. Us started, do have a question for our pollster team, Lori and Lucia. Anything particularly that stood out as surprising to you in the data from what you saw this year that you'd want to reflect on, or things that are different in Colorado from other states where you may poll?
I can start. Well, I definitely think, in past years, we've seen the mental health strain mostly attributed to financial challenges. It just lines up in so many ways with those experiencing multiple challenges, which is why we crafted that sort of composite view of how many people are experiencing all those different issues. The fact that politics and government is sort of leapt to the top, both of people's concerns for the state, but also attributing that to their actual health, is something really striking. I'm not sure I've asked that exactly that same way in other states, so I'm not sure we have a great comparison point there. It could be something lots of states are experiencing right now, but that was definitely that's sort of a new and different aspect of our lives here in Colorado that I don't know if we've seen in the past.
And I think one of the things that jumped out at me, I completely agree with everything Lori highlighted. And I think one of the most fascinating aspects was really around that civic engagement piece and some of the differences there, both on the partisan level, the difference in which people experience their ability to impact their community through their ideology, I think there's a lot more that we could explore there. And then also just based on the urbanicity piece, it was so striking to me that suburban residents felt like they could make so much more of a difference by speaking out than folks in urban and rural areas. And I think maybe that speaks to how folks in different communities are interacting with their neighbors and other folks. So I think there's a lot there that's super interesting and could be really productive too.
Thank you both for that. Julie, I have a question for you. With your experience working in both exploring healthcare gaps, and we heard a lot during this presentation about increasing mental health strain experienced by many communities across Colorado. Are you seeing maybe solutions is too strong of a word, but initiatives that are working or things that are working to help people address their mental health concerns, as well as tackle these healthcare gaps that are making the cost of healthcare feel so such a high concern for many across Colorado? Are you seeing bright lights that you open to sharing?
Yeah, I think the bright light is always in the wisdom and strength in the community. And so, first of all, people feel less mental strain when they feel some sense of agency and there's something that they can do and get engaged with. So that in of itself really helps. And I think the more we can resource communities to come up with their own solutions, the better. That we cannot continue to do what we've been doing in mental health because it hasn't worked. So we need more, again, more like the Therapists of Color Collaborative is a great example of a community-based solution that is really, really effective. That's just one example. And give communities the resources and they will figure stuff out for themselves. It's just getting the resources to the right people. I think that's a challenge sometimes, but community organizing is the way to make that happen.
Fantastic. Thank you so much. And Michael, we'd love to ask a question to you. Heard a lot about, during this presentation, folks feeling a little disillusioned with their effectiveness of reaching out to politics and politicians directly and the efficacy of different engagement efforts. How do you think that informs? You talked a little bit about the foundation's work around advocacy, but what do you see ahead in 2026? And again, or do you see organizations or initiatives that are working well to help connect Coloradans with policymakers?
Yeah, absolutely. And all I can say is go local. I think sometimes we feel so overwhelmed by what's happening globally, domestically, and even statewide with our public policy environment. And the most things that I can always encourage folks to do is to understand locally who makes the decisions that impact your day-to-day life. Often people are just within one phone call away. Often they're within one email away. You know where to go. Go down the block and go to their office. Folks especially folks who are in elective office, need constituent services. Like they need to hear from you and understand what you and your communities are expressing as their most highest concerns. And so I am always a champion for going local and picking up the baton where you best feel you can make an impact.
Wonderful. Thank you so much. And then just one last quick question in the chat, and I'll just say to folks that if you have questions after this, please reach out and we're happy to continue the conversation. Andy Mountain shared in the chat, struck by the slide of Democratic and Republican differences on particular issues. And he had a thought that the issues that are the most divisive, do you think it's safe to make the leap that those are plus or minus within a 10% difference? Are those opportunity areas for us to make progress and improve overall connection with one another? How do you read that data around spaces where Democrats and Republicans are kind of closer than they may be further apart?
Yeah, let me share that slide again. I hope it's sharing. and just so everyone can refresh their memory of what those issues are. And it really comes down to some of the, I think it's the most widely, first of all, the most intense concerns around cost of living, cost of housing, homelessness. Those are sort of the top tier concerns, are the ones where we see the least partisan distinction. Sort of everyone, and it's partly why they are at the top, because everyone is saying, yeah, I see that's a problem. And so their experiences in all of those areas are just recognizing that. I'd say the one that's really notable too is mental health, even though it's a somewhat lower, not insignificant, but somewhat lower than some of those cost concerns and homelessness were at the top. It is one that is far less partisan than other issues. And I think that's because people have had personal experiences, whether it's themselves or family members or kids or whomever that might be. There's just a greater recognition. How much we can do, I mean, that's a little hard because some of these are the most intractable problems, and they've been at the top of Coloradans' concerns for a long time in terms of cost of living, cost of housing, homelessness. So while we're not facing the partisan barrier there to getting something done, it's just that some of those are some of the more challenging problems in the state. Although I did see that rent apparently is coming down somewhat, which may be why we're seeing a little less intensity on some of the challenges, why they had dropped a few points here and there in terms of some of those experiences that I walked through earlier.
Thank you so much, Lori. With that, I am going to keep our eye on time and close us out. I just wanted to give a big thank you to all our speakers for sharing their insights today. As we mentioned, we have a final briefing on September 10th. It'll focus on the unique challenges and priorities of Hispanic and Latino Coloradans. That session will be presented in Spanish with live interpretation in English. And you will receive a follow-up email with a recording and additional resources. If you have any questions, please reach out. And also, if you're part of a coalition or community group that would like a presentation or conversation about the Pulse data, please contact me. We're happy to support those requests and help tailor the content to fit your needs. So please reach out. And a final, just huge thank you again to Lori, Lucia, Michael, Julie, and the entire Pulse Poll team. It takes a real group to pull this off, and we deeply appreciate your partnership in making all this work possible. So thank you again for joining us for today's conversation, and we hope you have a great afternoon. Take care.